Sacked Te Whātau Ora Health New Zealand Chair Rob Campbell has taken a swipe at the agency that he was charged with chairing on AM this morning, calling it half-baked and holding on to old bad habits. Take a listen.
The people who want a public health system are the ones who have got the responsibility to stand up and say, this has to work better. We have to run this in a different way. If we don't do it, then it will, in fact, continue to fall apart.
Because that's the truth. It is falling apart.
Yeah, look, I think people get discouraged by the falling apart word, but I don't know anyone in the public health system who would not say that we are in crisis situation. You've got to respond as if it's a crisis, the same way you would with a cyclone or a tsunami or an earthquake or whatever. It's one of those big events.
Looked good on a whiteboard, but in reality it's half-baked. Joining us now, Prime Minister Chris Hipkins. Prime Minister, good morning. Welcome to the program. Do you agree with that? It's half-baked?
I agree with another sentiment, which is that the old, which Rob Campbell also put forward, which was that the old system wasn't sustainable either and reform was required. We're only relatively early on in the piece of a major reform program for the health system, and there's still a lot of work to be done. The health system isn't where we need it to be, and so we are undertaking reform because the old system wasn't working. The new system, we've got a lot of work to do to make sure it does actually deliver on the improvements that New Zealanders deserve to see.
So you actually agree? It's kind of refreshing. You agree that the health system, that the new reforms you've done are half-baked at this point?
No, I didn't say that, Ryan. I did not say that.
What word would you use?
I think we've got a lot of work to do. Well, we've got a lot of work to do to make sure that the health reforms are implemented in a way that delivers the benefits that are required. Up until a couple of weeks ago, Rob Campbell was the person leading that reform program. Now we've got to put somebody else in place now. We're working through that process at the moment, who is going to make sure that the health reforms deliver the benefits that New Zealanders deserve to see.
It's a good point you make. He was the one that was leading it. He's the guy that you chose to spearhead these very important and very costly reforms. And he says it's half-baked. He says it's half-baked, and you're saying there's a lot more to do. So did you do it at the right time? Have you put the right people in place? Do you agree with some of his other criticisms? For example, he says that the staff, the managers there, are inadequate. A lot of them are inadequate and not suited to their roles.
Oh, well, as I've already indicated, in terms of the overall leadership of that, up until a few weeks ago, that was his domain rather than mine. I mean, those sorts of decisions around who's leading the reform, around the structure of the management teams, that's a governance issue, and he was until recently the head of the governance team. So he should have
fixed it.
We're now in... Well, we're in the process of appointing somebody who will now see through the reform program. There was no significant policy disagreement with Rob Campbell that resulted in him no longer being the chair of Te Whātau Ora. It was the fact that he was wanting to continue to provide an ongoing political commentary on other parties, including parties that weren't in government, that meant that he couldn't continue in that role. He's passionate about health, and I think that, he'll continue to express his views, and in many cases, we might even agree with those views. That's not the reason that he's not the chair of Te Whātau Ora anymore.
No, I know. That's not up for discussion. But what I'm trying to get at here is, do you agree with what he's saying, and do you need to actually reform the reform? Because it's not working, and he says it's not going to work. It's not going to get the outcomes that you want, particularly for Māori. I mean, he says about the Māori Health Authority, it's a creation of the Crown, not Māori. It should have had much more independence, much more money and power than it has. Its excellent leadership will make the best of what it can, but no one should think it is enough, good, or even good enough.
Well, if you take, there's a lot in there, but if you take 20 district health boards, each with their own management teams, each with their own systems and processes in place, you put them together and you try and streamline that, that is going to be a very big undertaking, and it's going to take some time to work through that. Has that work been completed? No, not even close to being completed. And so as a result, I don't think that we're seeing that we've got all of the gains in that space, in terms of reducing the spend on management so that we can spend more on the front line. That's one of the goals of the reforms. Still relatively early days, and we haven't seen all of that shake down yet.
Has it so far achieved any goals?
As I indicated, it's still very early days, and we have to acknowledge the health system has been under enormous pressure outside of the reform program as we deal with the global pandemic, and every health system in the world has struggled with that. Every health system in the world has seen some of their key performance indicators get worse over the last 3 years because of a pandemic that's put the system under enormous pressure. So I wouldn't want to say that the health systems aren't delivering any benefits. Benefits could, however, can be masked by the fact that they're dealing with this other massively big thing that will be hiding any progress that they might be making. Am I confident that they can make progress? Yes, I am.
Okay, so can you give us a date? Can you give Kiwis a date this morning? When will the health system improve on waiting lists, on some of those key metrics that are used to assess it, wait times in ED, etc.? When will that get better because of your reforms? I don't have a particular date, and it's not like there's going to be one magical date where these things are going to improve. If you take ED wait times, for example, one of the things we've got to do to get ED wait times down is recruit more GPs so that people actually are going to their GP rather than ending up in ED because they can't get in to see a GP. We've got work underway to do that. That's not an overnight turnaround, so that is going to take some time to turn that around. If you talk about elective surgeries or planned care, as we call it these days, we do want to see them starting to clear those backlogs of that. Many of those backlogs built up because of COVID-19 related disruption. We do want to see a real focus on getting those wait lists back down again. I don't want to put a particular time frame on that, but clearly for people who are waiting, it's an urgent priority. So we want to see them giving that an urgent priority as well. Okay. All right, we will wait and see on that one. Let's talk about the price of petrol, the price of oil, which is going to be an election issue, come hell or high water it is, because people are feeling the pinch and they're about to feel it even more. According to the AA, what has happened in the last 24 hours with Saudi Arabia and OPEC plus countries limiting supply, it means that our price is likely to go up, maybe by up to 10 cents a litre. When you include the tax, a subsidy, for want of a better term, that you've put on at the moment, that's 29 cents a litre when you take into account GST. So we're potentially looking at 40 cents extra per litre by June, July this year. How do you feel about what Saudi Arabia and OPEC plus countries are doing?
We don't get any control over the international price of oil. We just have to respond to that. So at the moment, the government has a reduction in fuel and excise levies so that we can help to offset some of that increase in the global price of oil. But we've also got a big program of work as a government and as a country ahead of us to move to more renewable energy sources, because ultimately the price of oil over time is likely to continue to trend one way, and it's not going to be favourable to people who have to fill up their car on a weekly basis. So we've got to do things that we can do to help to offset some of that cost. Faster uptake of EVs, looking at hydrogen alternatives, making sure that we're fast uptakers of those options.
No, I get all that. But if you're a New Zealander watching this morning who can't afford an EV right now and they've got to get in the Toyota and get to work this morning, how do you feel about what OPEC Plus and Saudi Arabia has done? Biden's really miffed about it because it's making his job controlling inflation so much harder. How do you feel about it? What is your message to them when they do this?
Well, regardless of how I feel about it, there's not a lot we can do about it. Of course, I don't want to see the international price of oil increasing. That is a disappointment for New Zealand, but that is a reality that we can't control, and so we have to do things that we can to support New Zealanders through. That's one of the reasons why we still have that reduction in fuel tax in place to offset some of that increase in international oil prices.
Okay, I know that you won't tell us this morning whether you'll continue that beyond June, July when it's due to end, which is fair enough. Right now, the average for a litre of 91 is $2.43 in New Zealand. What do you think is reasonable? What can people afford, and what won't you let it go above?
You're asking a hypothetical question about something that we haven't made decisions about yet. We'll make decisions about that through the budget process.
It's not a hypothetical question. What's a affordable price for your average Kiwi family for petrol?
As I've indicated, I'm not going to put a particular ceiling on something or a particular trigger point for when we do, fuel tax reductions or so on. We're working through that process at the moment, and we'll have further, decisions on that as part of the budget process.
You must talk to people in your electorate about what they can and can't afford. What do they tell you?
Oh, there's no question at all that the increase in fuel prices has had an impact on families. They're having to make decisions around alternative transport modes, on reducing the amount of time they spend travelling in the car wherever they can, and where they can't do those things, they're having to spend less in other areas in order to pay to fill up the car. It is putting households under financial pressure. I absolutely get that. Rising transport costs are one of the big contributors of inflation in New Zealand, and our rates of inflation are far higher than they've been in recent times. That's really biting into household budgets.
All right, we'll leave it there, Prime Minister. Thank you very much. Oh, quickly before you go, Jacinda Ardern is due in Wellington tomorrow for her valedictory speech. Is there a particular fond memory you have or a moment from her time as Prime Minister that you will remember tomorrow?
Look, I thoroughly enjoyed working with Jacinda. I think she made an enormous contribution to New Zealand. You can't get past the fact that she led New Zealand through some relatively challenging and in some cases horrific circumstances, whether it's a volcanic eruption, whether it was the terrorist attack, and of course the global pandemic. The pandemic alone, I think, will ultimately define a lot of her time in office, because it was such a big thing that we dealt with as a country and as a world, and I think she led New Zealand through that exceptionally well. All right.
Actually, Donald Trump's going to court today in New York. We've been following his plane this morning. Any advice for him?
No, I dare not even tread in that particular territory. I'll leave that to the Americans.